If you've ever had braces, you know the deal. But what if the whole experience could be, well, a lot more subtle? Today we're diving into a new scientific study that's given a classic dental tool a major aesthetic upgrade. And honestly, it might just change how we think about getting that perfect smile.
This is really the big question, isn't it? Everybody wants great results, but they also care about how they look and feel during the process, especially kids. So the real challenge is, can we get that perfect smile without the, awkward phase?
The specific problem we're zeroing in on is super common. It's when there's just not enough space in a child's lower jaw for all the teeth to line up properly. This is one of the main reasons kids end up in the orthodontist chair in the first place.
Now, for years and years, orthodontists have had a pretty reliable, if not exactly popular, tool in their toolkit to handle this exact problem. It's called a lip bumper, and it's basically this removable device that's designed to work with the body's own natural forces to gently, expand the dental arch and make more room.
So how does this thing actually work? Well, it's pretty clever, really. It's a three-part process. First, it acts like a little shield, blocking the constant inward pressure from your lips. With that shield in place, it allows the tongue's natural outward pressure to take over and gently nudge the arch wider. And third, it actively pushes the back molars upright, which creates even more length in the arch. It's a really cool use of biomechanics.
Okay, so if this device is so smart and effective, why isn't it everyone's favorite thing? Well, that brings us to the big challenge. This quote from the research really just hits the nail on the head. Just because they're kids doesn't mean they aren't self-conscious, right? Appearance really matters, and trying to get a kid to wear a bulky, visible appliance can be a really tough sell.
And here's the core issue right here. On the one hand, the lip bumper is a proven tool. The science is clear. It works. But, and this is a big but, it only works if the patient actually wears it for the 18 to 20 hours a day they're supposed to. Getting a kid to cooperate with something they think is uncomfortable and just plain ugly, yeah, that's the real hurdle.
So, what do you do when you've got a fantastic tool that nobody really wants to use? Well, you reinvent it, and that's where our story gets really interesting. Say hello to the ALBA. That stands for Aesthetic Lip Bumper Appliance. The goal here was super simple. Keep all the function that works so well, but completely lose the unsightly part. It's a total redesign with looks in mind.
Now, how'd they do it? This is where the material science gets pretty cool. Instead of that bulky acrylic pad in the front, the new bumper is made of a much more subtle fiberglass. And the parts that go over the molars, they're made from a clear plastic called PETG. The end result is an appliance that does the exact same job, just in a much, much more discreet way.
All right, so a new design is great, it looks better, but does it actually work as well as the original? That's the million-dollar question, right? To find out, researchers put the ALBA to the test in a real clinical study. So they took 23 young patients, average age of about 9.5, right in that sweet spot for this kind of early treatment.
And they tracked their progress over 9 full months. They took these incredibly detailed digital scans of their teeth right at the start, and then checked in again at 3 months, 6 months, and finally at the 9-month mark.
They were laser-focused on 2 key questions to see if this thing was a success. First, did the dental arch actually get wider? And second, did the crowding of the teeth actually get better? These were the make-or-break metrics.
Okay, so after all that data collection and analysis, what was the final verdict? Well, the results were pretty darn clear.
First up, let's talk about arch width. The ALBA was a home run. On average, the space between the first molars expanded by 3.5 millimeters. Now, that might not sound like a lot, but in the world of orthodontics, that is a huge amount of new space.
And what about that crowding problem? Well, using a standard measurement tool, they found that crowding was reduced by an average of 3.55 millimeters. So again, a really clear, statistically significant improvement. It absolutely solved the core problem it was designed for.
Now, this is really fascinating. The study also looked at when these changes happened. And get this, the vast majority of the expansion, we're talking a whopping 92% of it, happened in just the first 6 months. The most dramatic results happened right at the beginning of the treatment. And the final word from the scientists who actually ran the study? Well, it doesn't get much clearer than this. They found that the ALBA XFA delivered predictable, measurable expansion. Bottom line, it works.
So the really important takeaway here isn't just about a single new appliance. It's about this bigger idea that when you design medical tools with the patient's experience in mind, their comfort, their aesthetics, you can actually make the treatment itself more effective. The ALBA proves you can have both function and form.
And it leaves us with an even bigger question to chew on. As this technology gets better and better at just blending in, could those visible metal braces we all know eventually become a thing of the past?